Let's begin this discussion with a review of the following terms: occupational exposure limit, or OEL, threshold limit value, or TLV, time-weighted average, or TWA, and short-term exposure limit, or STEL. In general, the occupational exposure limit, OEL, indicates the level of admissible exposure for a length of time to a chemical or physical hazard that is not likely to affect the health of a worker. Different organizations and jurisdictions use different terms for the OEL, the most common one being the threshold limit value, or TLV. For the purposes of this course, we will use the term TLV instead of OEL, as it is most broadly referenced and used in both Canada and abroad. In Ontario, TLVs can be subcategorized into the following. 1. A threshold limit value time-weighted average, or TLV-TWA, is the time-weighted average airborne concentration level of a biological or chemical agent to which a worker may be exposed to in a conventional 8-hour workday and a 40-hour work week, to which it is believed that nearly all workers may be repeatedly exposed, day after day, for a working lifetime without adverse effects. 2. A threshold limit value short-term exposure limit, or TLV-STEL, is a 15-minute time-weighted average exposure that should not be exceeded at any time during a workday, even if the 8-hour TWA is within the TLV-TWA. The TLV-STEL is the concentration to which it is believed that nearly all workers can be exposed continuously for a short period of time without suffering from 1. Irritation, 2. Chronic or irreversible tissue damage, 3. Dose rate dependent toxic effects, or 4. Narcosis of sufficient degree to increase the likelihood of accidental injury, impaired self-rescue, or materially reduced work efficiency. The TLV-STEL will not necessarily protect against these effects if the daily TLV-TWA is exceeded. The TLV-STEL usually supplements the TLV-TWA where there are recognized acute effects from a substance whose toxic effects are primarily of a chronic nature. However, the TLV-STEL may be a separate, independent exposure guideline. Exposures above the TLV-TWA up to the TLV-STEL should be less than 15 minutes, should occur no more than 4 times per day, and there should be at least 60 minutes between successive exposures in this range. An averaging period other than 15 minutes may be recommended when this is warranted by observed biological effects. To better understand these terms, let's review how they could be applied to a typical exposure profile for a person working in a research facility that uses xylene in their work. The vertical axis identifies airborne exposure concentration in parts per million, the horizontal axis is time, and the horizontal orange line represents the time-weighted average exposure that this person is exposed to as a result of working for this 8-hour period in the workplace. One main question is, based upon the known exposure TLVs for xylene and this exposure profile, is this person overexposed? To do this, we need to compare the TLVs, both STEL and 8-hour TWA, of xylene to this exposure profile. To help consider these factors, during the time between 10:45 and 11:15, the exposure concentration ranges between 100 ppm to 145 ppm. The TLV-TWA for xylene is 100 ppm and is exceeded during this period, but the TLV-STEL for xylene, which is 150 ppm, is not exceeded during this period. According to our rules on these TLVs, an overexposure would be considered in the following cases. The 8-hour TLV-TWA is exceeded, which is not the case here because the 8-hour exposure concentration was found to be 32.1 ppm. the TLV-STEL is exceeded at any time, which is not the case here, or the TLV-TWA is exceeded for longer than 15 minutes at any time during the day, even if it is less than the STEL-TWA value, which does occur between 10:45 and 11:15. So, in this particular case, this person would be considered to be overexposed to xylene. We recognize that this may be complex or confusing, but keep in mind, if you are concerned about exposures you may have in the research facility, contact your supervisor. If you need further clarification, you can contact the safety office.